Nursing 345, Assessment Techniques and Safety in the Clinical Setting. This slide has the objectives listed for this week. They are: describe the 8 characteristics included in the summary of each patient's symptom, relate developmental care during health history for a child or older adult, discuss the use of inspection, palpation, percussion, auscultation as a physical exam technique, understand the use of blood pressure cuff or of improper size to the possible findings that may be obtained. List the information considered in each of the 4 areas of a general survey, which include physical appearance, body structure, mobility, and behavior. Assess and acknowledge the different types of pain. Recognize developmental care as well as cross-cultural and gender considerations regarding pain. List the steps of a complete health assessment. Explain the difference between a focus and a complete health assessment. Describe the techniques needed to perform a complete health history and physical exam. Document the results of the examination and identify the tools needed to complete a physical exam. Physical examination requires the sequential use of 4 assessment techniques. They include inspection, palpation, percussion, and auscultation. Inspection is close, careful observation of the individual as a whole and then of each body system. Use the patient's body as the control and compare the right and left sides of the body to determine symmetry. Inspection requires good lighting, adequate exposure, and sometimes the use of certain instruments such as an otoscope or pen light. Palpation is the use of touch to assess texture, temperature, moisture, and organ location and size. This technique also helps identify swelling, vibration, pulsation, rigidity, spasticity, crepitation, lumps or masses, and tenderness and pain. The fingertips are the best for fine tactile discrimination. Grasping with the fingers and thumb is ideal for detecting position, shape, and consistency of an organ or a mass. The backs of the hands and fingers are good for determining temperature. The base of the fingers or the ulnar surface of the hand is best for assessing vibration. Light palpation detects surface characteristics and accustoms the person to being touched. Deep palpation assesses an organ or mass deeper in the body cavity. Bimanual palpation requires the use of both hands to envelope or capture certain body parts or organs. Percussion is tapping the patient's skin with short, sharp strokes to assess underlying structure. This technique is used to assess the location, size, and density of an organ. It can detect a fairly superficial abnormal mass or elicit a deep tendon reflex. To perform percussion, hyperextend the middle finger of your non-dominant hand and place its distal joint and tip firmly against the person's skin. Then use the middle finger of your dominant hand to strike the stationary finger at a right angle. Deliver 2 even staccato blows using a quick wrist action. Each percussion sound has 4 components. The 4 components are amplitude, and that is the sound's intensity, which may be soft or loud. Pitch, or frequency, describes the number of vibrations per second. Quality is the subjective difference resulting from a sound's distinctive overtones. Duration is the length of time the note lingers. Auscultation is listening to sounds produced by the body, usually using a stethoscope. The heart, blood vessels, lungs, and abdomen are commonly auscultated areas. Use the stethoscope's diaphragm for high-pitched sounds such as breath, bow, and normal heart sounds. Use the stethoscope's bell for soft, low-pitched sounds such as extra heart sounds or murmurs. To ensure accurate auscultation, eliminate confusing artifacts. For example, by making sure the room is quiet and warm and not listening through clothing. Equipment that you may require is a platform scale with height attachment, skin fold calipers, sphygmometer, stethoscope, thermometer, pulse oximeter, pen light, otoscope, ophthalmoscope, tuning fork, nasal speculum, tongue depressor, cotton balls, pocket vision screener, skin marking pen, flexible tape measure and ruler, a reflex hammer, a sharp object, You can use a split tongue blade, bivalve vaginal speculum, clean gloves, materials for cytologic study, lubricant, and fecal occult blood test materials. The examination room should be warm, comfortable, quiet, private, and well lit. Before beginning the examination, ensure that all your equipment is within easy reach and laid out in an organized fashion. You should observe infection control measures to prevent the spread of infection. Maintain clean equipment and a clean field when doing the exam. The most important step to decrease microorganism transmission is through hand washing or using an alcohol-based hand rub. Perform hand hygiene before and after physical contact with each patient, after contact with body fluids or contaminated equipment, and after removing gloves. Use standard precautions for all patients. Use transmission-based precautions for patients with documented or suspected transmissible infections. Reduce patient anxiety by beginning with familiar, non-threatening actions such as measuring height, weight, and vital signs. After the person puts on a gown, return to the room and clean your hands in his or her presence. During the examination, make sure to explain each step and how the patient can cooperate. Proceed systematically and offer brief teaching as appropriate. Adjust the examination position, preparation, and sequence based on the patient's developmental needs. You need to consider, if it's a child, you need to consider the child's developmental stage when determining the examination sequence. For an aging adult, adjust the position and preparation as needed. Pace the examination to match the older adult's pace, which may be slowed. When examining a patient in distress, you may need to alter the position during the examination. First, collect a mini database and then complete the assessment after the initial distress is resolved. So in summary, the hands-on practice would include measurement and vital signs. Begin with the person's hands. Concentrate on one step at a time. Remember your examination sequence and consider the child's or the older adult when you are preparing to perform your examination. Do brief health teaching throughout the examination. When findings are complicated, you may have to contact someone else and summarize findings for the person when you are all done the exam.